The number one question I get on social media is this: how can I get bigger? Guys want to know about length, about girth, about whether any of those products and procedures actually work. And I get it. This is deeply personal. But here's what most men don't realize. A survey of 50,000 heterosexual men found that 55% were unhappy with how their penis looked. But when researchers asked their partners, 85% of women were completely satisfied with their partner's styles. That disconnect, it's massive. And it's driven largely by pornography, which has completely blurred the lines of what's actually normal. I'm Dr. Victoria Lee, and today I'm giving you the science-backed truth about penis enlargement, what actually works, what's dangerous, and what you need to know before you do anything you can't undo. Let's start with the facts. The average erect penis length is about 5.2 inches or 13.2 centimeters, and it's completely normal for length to fall within 2.5 standard deviations of that average, either larger or smaller. So what's considered medically abnormal? Anything under 2.9 inches or 7.5 centimeters. That's called micropenis, and it affects less than 0.14% of the population. Extremely rare. Micropenis can be caused by congenital abnormalities, hormonal issues, previous surgeries, or cancer treatment. But here's the key point. The vast majority of men concerned about their size have completely normal length based on these numbers. The real issue isn't size, it's anxiety. There's actually a clinical term for this: small penis anxiety. It's a form of body dysmorphic disorder where men have a preoccupation or obsession with the size of their penis, spending over 1 hour a day thinking about it. And this isn't trivial. Some men become so distressed that it affects their daily activities. Some end up hospitalized. Some experience suicidal ideation. This is not a joke. This is a serious psychological condition with real, potentially life-threatening consequences. And that's why addressing it properly matters so much. Here's the problem. If you Google how to make my penis bigger, you'll be inundated with websites promising miracle results. Most of them are scams. Some are outright dangerous. Men travel abroad for procedures. They find unlicensed providers, and they end up with devastating, irreversible complications. Please, don't do that. The Sexual Medicine Society of North America is clear on this. Procedures for penile lengthening or girth enhancement are not recommended and are considered experimental, except in the context of treating micropenis. Everything I'm about to share with you exists in the medical literature and has some data behind it. But that doesn't mean it's safe, effective, or recommended for routine use. If you're serious about this, you need to work with a reputable urologist and a psychologist who specialize in sexual health. Not a website, not a clinic in another country. A licensed, board-certified professional. There are two categories of treatment: non-surgical and surgical. Let's start with non-surgical options, because this is where you should start if you're going to pursue anything at all. Option number 1, psychological counseling. This is the most important intervention, and it's often the only one you need. There are validated assessments and questionnaires that help you understand what normal penile size actually is and address the anxiety driving your concerns. Here's what's remarkable. When you look at men who undergo psychological counseling alone, without any physical intervention, the vast majority no longer want to pursue surgical or non-surgical treatments for lengthening. They realize their size is normal. They work through the anxiety, and they stop obsessing. This is big. If you're dealing with anxiety about your size, please seek psychological care first. It's the intervention with the best outcomes and zero physical risk. Option number 2, penile extenders, the only one with real data. Penile extenders are devices that apply mechanical traction to the penis over time. They consist of a base where you insert the penis, 2 metal rods on either side, and a silicone ring at the end to hold the head in place. The device slowly and gradually stretches the penis over a period of months. And when you look at the research, men who use these devices religiously for several hours per day, every day, for months, did gain some length. How much? About 2 centimeters. That's roughly 0.8 inches. The length was measured using flaccid stretch length, which urologists use to estimate erect size. So the gains are real, but they're small. And there are complications: numbness, bruising, and in many cases, no benefit at all, despite months of effort. This is the only non-surgical option with consistent data showing it works. But the commitment required is enormous, and the results are modest. Option number 3, vacuum erection devices. Vacuum devices did not increase penile length at all in studies. Zero measurable gain. So despite marketing claims, there's no evidence they work for lengthening. Option number 4, penile injections. Do not do this. There are various injectable substances marketed for penis enlargement, and I cannot stress this enough. Do not inject anything into your penis. These injections have caused devastating complications, sometimes appearing decades later. We're talking about disfigurement, loss of function, chronic pain, and the need for reconstructive surgery. The data is not strong enough to recommend any injection, and the risks are catastrophic. Please, do not do this. Multiple surgical techniques have been described in the medical literature. The most common is suspensory ligament incision. The penis is anchored to the pubic bone by a ligament. By surgically releasing that ligament, you can gain a small amount of visible length. But this procedure is not without complications: loss of erectile angle, instability, poor cosmetic outcomes. Other techniques involve using flaps, grafts, or even rib cartilage to increase length. But overall, these surgeries have poor outcomes and poor patient satisfaction. And here's the critical issue. The studies reporting on these surgeries have not been rigorously conducted or documented. Sample sizes are small. Follow-up is inconsistent. Complications are underreported. At this time, we cannot recommend surgery to increase penile length. The risks are too high, and the results are too unpredictable. The only exception, clinical trials. If you're going to pursue surgery, it should only be in the context of a clinical trial at an accredited institution with an Institutional Review Board, or IRB. What does that mean? It means the study is overseen for safety and ethics. Adverse events are monitored and reported. Data is collected rigorously, and outcomes are published transparently. This allows the medical community to evaluate whether a procedure is safe and effective. For an example, if 100 patients undergo a procedure and 10 have minor complications while 20 have devastating outcomes, we know to stop. That's how science works, and it's the only way to ensure you're not becoming a cautionary tale. Here's the hard truth. There's not a lot you can do to meaningfully change the length you were born with. You can gain a small amount, roughly 2 centimeters, with penile traction therapy if you're willing to commit months of daily use. That's the only non-surgical option with real data. Everything else, either unproven, ineffective, or outright dangerous. Many procedures are still under investigation. They are not recommended for routine care, and pursuing them outside of a clinical trial could leave you with something far worse than what you started with: disfigurement, loss of function, chronic pain. So here's what I recommend. First, start with psychological counseling. Work with a therapist who specializes in body dysmorphia and sexual health. Address the anxiety driving your concern. Most men find this alone resolves the issue. Second, if you're still interested in physical intervention, talk to a board-certified urologist who specializes in sexual medicine. Get a realistic assessment of your size, your options, and the risks involved. Third, avoid anything that promises dramatic results. If it sounds too good to be true, it is. Don't travel abroad. Don't visit unlicensed providers. Don't inject anything into your penis. And finally, remember this: your partner is likely already satisfied. The disconnect isn't between you and them. It's between you and your perception of what's normal. Porn isn't real. Averages are averages for a reason. And your worth as a man, as a partner, as a lover, has nothing to do with a number on a ruler. Gentlemen, I know this topic is deeply personal, and I know the answers I've given you today aren't the ones you were hoping for. But honesty is more valuable than false hope, and protecting you from irreversible harm is more important than selling you a fantasy. If you're struggling with anxiety about your size, please seek help. Talk to a psychologist, talk to a urologist, but don't suffer in silence. And don't make decisions out of desperation that you'll regret for the rest of your life. This is Dr. Victoria Lee reminding you that your value isn't measured in inches. It's measured in how you show up, how you connect, and how you treat yourself and others with respect. Stay strong, gentlemen. If this helped you, hit subscribe for more honest, science-backed advice about men's health, and drop a comment below. This is a tough topic, but your honesty might help another guy realize he's not alone.